board leg below 2 years children. Actually, most of the board leg, the complaint by the parents are physiological. How you will understand it is not a disease. The board leg which has normal X-ray, normal ALT and ALP, and then you have other echotic data like calcium phosphate, they are the normal, and X-ray also not pathognomic of any decaying and other changes. Usually this physiological bowing is symmetrical and it gets corrected by 2 years or so. But when there is other way around, when you have other diseases like idiopathic tibial vera, it is a blount disease, other name of it, and it is a disease where you have some amount of progression. It is not that physiological. It doesn't correct by yourself. How you will understand it is not physiological. There will be asymmetry in the leg length. One side length is taller, other one is shorter. Metaphyseal angle is a little bit higher, more than 11 degree, and there is because of the lateral thrust, and it is more common in the obese female child. Maybe in America it is more common in the black people, and may have this sort of the bowing, may have the progression. They have you have severe sort of deformity which is to be corrected by 4 years or so. So vitamin D deficiency, how to differentiate? Nutritionally malnourished child, vitamin D, calcium and ALP, they are diagnostic. ALP is higher universally in all vitamin D deficiency almost, and and genetic disease resistant vitamin D, they have, apart from this extra changes and the ALP they have genetics, underlying genetics. In diagnostic, they have other specific diagnostic point in the liver and kidney involvement, and their features in the lab data also. So other one is the dysplasia, metaphyseal achondroplasia and chondromatosis, and then in the fibrocartilaginous dysplasia. They have their unique features. As achondroplasia, the short stature, dysmorphic features, and an upper trunk, bigger trunk than the legs. So they are diagnostic of they have the also X-ray data are different from your rickets and the physiological, which is normal X-ray everything. So apart from this, the child can have board leg by dint of infection, the osteomyelitis, your trauma, and then obviously the history will be there. And tumor rarely possible. So look the limbs carefully and see whether either of these things is there. If no idiopathic vera, tibial vera, decadic changes, yes, not there. Decadic changes, you will have other changes in the chest, and then other features of the case might be there. So nothing. So then only you say it is physiological and issue the parents.